Being an agent of change. The clinical nurse specialist is built on a philosophy that we impact three broad areas: the patient, the nurse, and the hospital system. There are a lot of unknowns in the intensive care realm in a post-pandemic, mid-pandemic world in which we all exist right now, and the constant drive to deliver the highest quality of care is what motivates me at work on a daily basis. I'm fortunate that I get to partner with exceptional nurses and a great leadership team that are eager to deliver the most up-to-date evidence-based care to our patients. During the last year, we've seen significant practice changes due to the complexity of the COVID-19 pandemic and the drastic effects it has had on how we deliver care in the ICUs. From a quality perspective, we are currently working on getting back to the evidence-based practices that we have all had ingrained in our bedside care for years. Across the country, we've seen an increase in all hospital-associated infections such as CLABSIs and CAUTIs. Getting back to the basics of CAUTI prevention is important to ensure that we don't see a rise in the incidences as we start to see spikes of COVID cases across the country as we enter the winter season. I think a great overall theme in hospitals right now is back to the basics for all patient care. I believe that it is a necessity going forward in a new COVID world that we are all living in. As a critical care CNS, nurse-sensitive indicators are my main focus. Currently, unit-based HAIs are my priority, and we are working on getting back to the basics on the prevention of CAUTI. The first intervention that we have initiated is unit-based guidelines for appropriate and inappropriate indications for urine cultures. Next, we're also working on ensuring proper CHD bathing every 24 hours, PRN and every 8-hour catheter care, ensuring that the seal is not broken and the tamper seal on the catheter, making sure that there are no dependent loops that can cause a backflow of urine or pooling, and to make sure that our catheters are always freely floating and not touching the floor. The most important way to prevent CAUTIs is to not have a catheter at all. So utilizing your institution's resources for external catheters is highly recommended and the best way to prevent catheter-associated urinary tract infections.